Is it record? Can you see anything? Can you just see my screen? Can you see me? Oh, well, how about that? Alrighty. Well, I can't see anything other than my screen. So super awesome. Give me a second. I'm gonna close down this other computer. So I'm not three computers trying to figure out what in the world is going on. So sorry. Hi. All right. So I want to talk about wellness medicine, and there's so much to cover. So it gets to be a little bit overwhelming for so many people because there really is so much that we offer here and so much that we can do for wellness. So probably going to do this in two parts. And tonight we're going to talk about wellness medicine, but a lot of things. We're going to talk about what is wellness medicine and functional medicine, hormones. We're going to talk about medical weight loss and the new programs that we have for medical weight loss. And when I was doing this presentation and writing it, I was combining some of my previous ones and adding new things, of course, and it really ended up being like 300 slides. Nobody wants to listen to me for 300 slides. I sure don't want to. So I'm going to break it into two parts. Who knows? I'll record the other one. Yeah, who knows? Maybe I'll record it after we end this one. I don't know. But I'm so passionate about this, and I haven't been able to do any talks lately just because of some stuff that's been going on in my family with my father being ill. So without further ado, let's talk about wellness medicine. And really, technically, you're just supposed to see my slideshow and me, but nothing's working. So this will do. All right. Wellness medicine. So do you suffer from stress, low energy, thyroid issues, difficult weight loss, poor digestion, trouble sleeping? I would pretty much say that's almost all Americans, right? Even those of us that do wellness medicine and try to practice wellness medicine and wellness lifestyle, we definitely still have some of these things, unfortunately. So how can you benefit from what we do in wellness medicine here at aNu Aesthetics and Optimal Wellness? Again, do you have things that fit under this category? Fatigue, insomnia, anxiety, depression, hormonal changes, mood swings, hot flashes, night sweats, low libido, vaginal issues, erectile dysfunction issues, weight gain, that's one of the biggies, obviously. Do you have high cholesterol, diabetes, heart disease? Another one I see a lot is elevated liver enzymes and fatty liver that nobody can get rid of. Sugar, carb, salt cravings, requiring caffeine, afternoon crashes, brain fog, memory issues, acne, wrinkles, skin laxity, volume loss, pain, migraines, autoimmune, hormone, thyroid problems, and of course, GI. I do a ton of GI. So really what you can see is that everybody can benefit from wellness medicine. If you're extremely healthy, wellness medicine is great just to optimize health, looking at nutrients, micronutrients, looking at nutrition, and so forth. That's not the majority of my patients. Unfortunately, because of toxins and a lot of things we're going to talk about, most people do have obviously some of these symptoms and signs. All right. How am I different than a primary care physician? Well, I am a primary care physician, but I'm also more. So I've been board certified for 12 years. Been doing family medicine, if you include my family medicine residency, for 15 years. That's crazy. My second board certification in functional metabolic nutrition. And really what I try to do is look for the cause of issues. So functional medicine, the difference between functional and conventional medicine, which we'll talk about in a minute, is that traditional medicine is up here where the tree is and the tree branches. And, when we have a symptom or a sign, there's a medication, there's a diagnosis name for that. And then there's a medication for that. That is traditional medicine. The difference is in functional medicine, you go back down that tree trunk and you look at all the branches, you look at all the roots, okay, in the soil. And that's what we do, is we're looking for the cause of your issues rather than just the symptoms and treating them with pharmaceuticals. I get the pleasure of spending 45 minutes to an hour and a half with my patients. I really get to know my patients, and I really get to spend time understanding social issues, economic issues, background, environment things, where they've lived, because all those things are really important. And then the other thing that I can do is some pretty advanced comprehensive wellness labs to look at all of these things we're going to talk about. It's another question I get is, well, how do you know if I have any of these things? You see one of us, myself or my nurse practitioners, and we do testing, okay? So we can look at nutrition, inflammation, toxins, infections like Lyme, looking at other criteria for Lyme, et cetera, food sensitivities, hormone levels, nutrient, vitamin levels, basically the things that we're not taught in conventional medicine. For me, I wasn't taught how to figure those things out, diagnose them, et cetera. Okay. So again, conventional medicine versus functional medicine. Conventional is disease oriented versus health. And I really feel like there's been a big shift in the last 2 to 3 years, obviously with COVID. There's some good things that came out of COVID. One of them is virtual events, when internet and things work. And also people are really getting back to preventative medicine instead of, what do we do when we're already sick and we're already in the hospital and there's already things going wrong? Because we're pretty late in the game at that point. Okay. So conventional medicine, doctor-centered versus here it's patient-centered. Conventional, everyone's treated the same. It is more cookbook. We're taught how to treat everyone very much the same versus here it's holistic, mind, body, spirit. Conventional medicine is specialized. We've given a doctor the brain, we've given a doctor a heart, we've given a doctor the reproductive organs, etc. Versus in this practice, we look at everything, right? You see one provider that treats you. Diagnosis is based on symptoms, like we talked about before, and it's about disease in traditional medicine. And functional medicine is about prevention, and that we understand that all of us are biochemically different, socially different, etc., genetically different. All right. So this is one of the main things I hear from people, right, is that you've gone to your primary care doctor, you've shared with them your issues, your concerns, and they do your labs. They do a few labs on you, if you will, and your labs come back and they're normal. Okay, great. Well, I don't really feel normal. I was in that situation 7 years ago when I decided to actually quit doing traditional medicine and go into functional medicine. So you hear, go home, you need to exercise more, you need to work out, you need to sleep better, you need to eat better. Okay, well, but what's wrong with me? I know there's something going on with me and I don't feel right. I have this fatigue, or I can't sleep. I have anxiety. I have these GI issues. I have this rash nobody can explain. I have these hot flashes, whatever it is. You feel like nobody's listening, and you know that that's not a normal feeling. Okay. So if you're seeking answers for vitality, health, wellness, or literally just to get yourself back, this is where you can come. So normal is not optimal ever, ever, ever. Okay. So I say that, and I mean it very much, because LabCorp and Quest and other labs have parameters that are either very narrow or way too big. For example, vitamin D levels says that your vitamin D should be between 30 and 100, when in fact, you should be upwards to 60. Okay. So it's definitely not, you should be between 60 and 100, upwards to 100. So we're definitely going off of old values that have never been updated. Thyroid is another example. There's a million examples, but hormones are a big example. Okay. So what are hormones? They're proteins or derivatives of cholesterol manufactured in the endocrine glands. We have a lot of hormones. A lot of us just think of sex hormones. That's not true. We also have hormones secreted in our brain by our pituitary. In our hypothalamus, we have the thyroid. We have the adrenal glands that sit on top of the kidneys. We do have all the sex organs. We also have the pancreas, which secretes insulin, which I'm not even going to get to talk to you very much about today. But we have a lot of hormones in our body. And the endocrine system is extremely important and really affects everything that we do. Women more so, okay? And that's because women's hormones fluctuate during pregnancy, after pregnancy, and then menopause. Men's hormones fluctuate too, but not very much, all right? They do go through andropause, but it's not the same. And so women tend to suffer more or at a younger age. Okay, so they're released into the bloodstream and they exert a very specific biochemical effect on organs and cells. And so hormones affect every single cell in the body, and they have different actions depending on the cell type, right? Ovary cell, heart cell, brain cell, thyroid cell, etc. So what's really important, though, is understanding that when our cells don't work and our mitochondria don't work due to toxins and all the other things we'll talk about later, our hormones are not produced correctly, okay? Because the mitochondria, the powerhouse of the cell, is required to function properly in order to be able to detox and make energy. Energy also makes hormones, okay? Also makes neurotransmitters. So it's really an ongoing theme. You'll hear me talk about in wellness. You'll hear me say a lot of things over and over tonight because they all connect, as they should, right? That's what functional medicine is about, where it should make sense when somebody's explaining to you why you have 35 symptoms and you feel like you're falling apart. It's like, no, you just have 3 things going on and they're all connected, and we'll fix that, okay? This is just the hormone cascade for sex hormones. you can see how complicated this is. And this is just sex hormones. So we're not trained in traditional medicine how to look at sex hormones, how to know what the optimal level of pregnenolone and progesterone, aldosterone, cortisol, DHEA, estradiol, testosterone. We are not trained how to know what optimal levels those are, nor how to treat. And the reason is because those are natural chemicals, okay? And pharmaceutical companies are not allowed to make natural chemicals. So why do hormones change? Aging. Aging causes hormones to change, and hormones cause aging to change. That's awesome. Stress is a biggie, okay? I don't think everybody's realized that in the last couple of years. My poor patients going through menopause and COVID in the last 2 years have really struggled, okay? When they come to me, and then we help them decrease production, decrease stimulation, cell destruction, mitochondrial damage, toxins, a million reasons, okay? Inflammation, what we eat. Bioidenticals, they're for all ages, PMS, PMDD, infertility, perimenopause, menopause. So I treat patients all the way from young girls in high school, all the way up to patients. My eldest patient is in her 80s, and she is still on bioidentical hormones and living a vital life, very vital. But I do treat young female patients that also have PMS, PMDD, PCOS, ovarian cysts, etc. Okay, so hormones come into play way before we even think that they do. And the answer in traditional medicine, which is what I used to do, is give everyone birth control. And unfortunately, that stops the entire cascade. I'll go back here. It actually turns off this hormone cascade. Okay, so birth control, IUDs, etc., will actually stop this hormone cascade from its production, thereby inhibiting your production of DHEA and testosterone and estrogen. Hence, still some moodiness and some other issues, irritability sometimes, but vaginal dryness, low libido, etc. Okay, there's a lot of things that we don't want it to do. Bioidentical hormones really help slow decline, of hormone loss. They also replace it. Okay, and it allows us to stay resilient and vital, which is what my patients are looking for. So why don't doctors prescribe hormones, or they tell us that they're not safe? I was told the exact same thing in medical school residency. Okay, we don't learn about them because they're not pharmaceuticals. Physicians in traditional medicine are taught about pharmaceuticals. So if there's a physician that wants to learn about this, or a medical nurse practitioner, etc., we have to go out and get certified and learn all this on our own. So we literally have to get into a fellowship, do certifications, to get our own training. And then, I'm lucky enough to have a business. And so I was able to bring that into my business. But there's so many doctors and nurses and nurse practitioners out there that really do want to practice this type of medicine, but they're not business savvy or don't have a practice that's willing to hire them. So they are stuck in traditional medicine because they don't have the means or the place to go practice this type of medicine. It's a really big deal. Okay. I'm sorry, to drink water. So most hospitals and insurance don't support this and don't pay for it and don't cover it. Therefore, it's not mainstream. Okay. It is becoming much more mainstream for sure in the Midwest in the last couple of years. I'm so glad I started wellness medicine in the Midwest 7 years ago. The coast has had it figured out for a long time, especially California, Arizona, but we're just starting to figure that out here. The other thing is that we're taught in medical school that hormones are bad. Okay, we are told all hormones are bad, which is not true. Synthetic hormones are bad, right? The problem is that it is still a myth that is perpetuated in medicine that all hormones are bad. I am here to tell you that is not true. There's thousands and thousands of studies in PubMed and everywhere else you can look that tell us that BHRT, bioidentical hormone replacement therapy, is actually beneficial for patients in many, many ways. Okay, so Women's Health Initiative trials, most of you have heard about this. This is when there was a study going on estrogen. That's all we ever hear about. It was an estrogen study, and estrogen was causing heart attacks and blood clots. So that study was stopped. That is in fact true, partially. So that was in 2002. And that is when Premarin was being used, which is synthetic. Okay. So that is synthetic estrogen that comes from a pregnant female horse's urine. So we can't even produce that in a lab. All right. Also had Provera in it, which is synthetic progesterone, neither of which I prescribe. Okay. So that was Prempro, synthetic estrogen and progesterone. What they actually found out is that it was the progesterone, the Provera that was in that was causing the problems. but nobody ever, media didn't ever talk about that. So in that arm of the study, they allowed estrogen and progesterone to go separate. And they discovered that it was actually the Provera, which was synthetic progesterone, that was the main issue. Okay. However, in all the recent studies on bioidenticals, what it shows us is that there's not that same effect because they're natural. Okay. So they're the same that your body makes. Your body knows what to do them. Again, they can't be made or patented by pharmaceutical companies, and they're made with natural ingredients. And here at aNu, I don't do just one kind of medicine. It's very personalized. So we do capsules, creams, troches, implants, pellets, what they're called, injectables. Really, it's personalized medicine to each patient. Everybody's got a preference and a reason why they want something. We just help you decide which one might be better for you. Okay. Thyroid. Most people understand the thyroid, but what I'll tell you is it affects every single thing in your body, from the hair on your head to the toenails on your toes. Okay. So thyroid, when it is abnormal, affects everything profoundly. Thyroid gland sits here in the neck, regulates your temperature, your metabolism, your brain function, your fat breakdown, your cholesterol, hair, skin, and nails, everything. Symptoms, I think a lot of people know these symptoms, but fatigue, lack of energy, inability to lose weight is a big one, or weight gain, forgetfulness, confusion, depression, anxiety, hair, skin, nail issues, and pain and muscle cramps, okay? Also issues with periods and fertility, right? So thyroid labs, why do we miss this in so many patients in traditional medicine? Because we're trained to only check your TSH, thyroid stimulating hormone. We are not trained to check your T4, T3, free T4, free T3, which are actually the bioavailable forms of thyroid hormone, okay? So if we're not checking those, then we miss subclinical hypothyroid and patients continue to suffer. The other thing is that most traditional medicine, we prescribe T4, which is levothyroxine or Synthroid, and most people need T3. So you need a combination, compounded medication that's natural. The other thing, going back to thyroid, that we miss is autoimmune Hashimoto's. It's not widely tested in traditional medicine, so a lot of thyroid Hashimoto's goes undetected until you see me. Estrogen, produced by the ovaries and the adrenals, and yes, men also make estrogen. They make it from the conversion of testosterone, which is why men have to be careful with taking too much testosterone or exogenous steroids, because that will convert into estrogen and cause enlarged breast tissue. It will shrink gonad tissue, and it will feminize them. Okay. So those are things that we really check. Remember that hormone cascade up at the top that we talked about. It's so important to be seeing somebody who's certified and understands the hormone cascade and how you have to check DHEA, pregnenolone, and estrogen, and DHEA and testosterone, even if you're a male, because males, if they are given too much testosterone, they will actually start to secrete and convert to estrogen. Okay, estrogen benefits, lots. Okay, big things that women tell me when they start going through menopause, obviously mood and libido, okay, and vaginal dryness, but muscle tone and skin. They start to get wrinkles, dry skin, decreased muscle tone, all right? Some of the things that are medically helpful: reduces Alzheimer's, decreases osteoporosis, also decreases your bad cholesterol, and thereby decreases heart risks such as heart attack and stroke. Okay. Progesterone, very, very, very commonly low in young females that have infertility, PMS, PMDD, mood changes, etc. Okay. So it's usually the first hormone to decline, usually due to stress. There's something called cortisol steal. We won't go into that, but it's made by the ovaries and the adrenal glands, and the adrenal glands control cortisol, which is your stress hormone. Okay. So the first thing that is usually altered is cortisol, which is why, progesterone, which is why I do have young females on progesterone. Okay. Testosterone. Yep. We all make it. How do I prescribe testosterone? It's like the Superman drug. Okay. It's a wonderful drug. And when we don't have it in our body, the hormone is not being produced and we do not feel well. Okay. It enhances mood, well-being, zest for life, also increases muscle mass, lowers fat ratio, increases libido, sexual function, but it also decreases bad cholesterol and increases good cholesterol, things they don't tell you. Okay. Also, just FYI, testosterone does not increase prostate cancer according to studies at Mayo. Okay. DHEA is the other hormone that's made by the adrenal glands and by the ovaries, similar to progesterone. It is a building block for other hormones. And low levels of DHEA are associated with an increased mortality from heart disease. Why? Because DHEA decreases inflammation. Okay. So improves immune system function, relieves stress, anti-cancer, antioxidant, increases energy, reduces body fat, increases insulin sensitivity, protects against diabetes, anti-inflammatory, right? Melatonin secreted in the brain. People always ask me, can I get addicted to melatonin? Is there too much? Can I not take it every night? Yes, you may take it every single night. If your body needs it, the way you know literally is to take melatonin, okay? Starting at a low dose. If you sleep and you don't have bad dreams, you are deficient in melatonin. We can check that, but it's a difficult test to check for just because you have to wake up in the middle of the night, interfere with your sleep, and check your melatonin level. Pregnenolone, another body hormone, okay? This is a sex hormone, brain, mood, memory, all right? Very, very big. So not found in food. I don't usually replace this one until post-menopause because it makes all the others, but very, very critical hormone, okay? Studies, again, I could give you thousands of studies all the way back to 1990 and 2000, okay? This is just to show you that this isn't new. For the last 20 to 30 years, it's been proven time and time and time again that bioidenticals are safe. So men and women on hormones had a positive response. Only in the control group that were not on hormones had significant detriment. And that's all the way back from 2000. Okay. Hormone treatment, just said it, right? All of the new studies are showing how beneficial it is. Vitamin D, yep, it's a hormone too. It's got a lot of rave about it, right? With COVID, because it definitely helps protect the immune system. Okay. I mentioned this earlier that traditional medicine lab levels are outdated. Optimal levels are 60 to 100. And the other thing that we're taught in traditional medicine is, get your lab levels up on vitamin D and then you can stop it. That is not true. When you stop vitamin D, your levels will go right back down. So vitamin D for my patients, when I know their lab levels, it's a lifer, okay? So anywhere from 5,000 a day, 10,000 a day, 50,000 a week, 50,000 twice a week, depends on what your needs are, okay? Cortisol, stress hormone. Oh, this is the hard one, okay? So if you have fatigue and other issues such as crashing, craving, hormone issues, immune system issues, insomnia, etc., you probably have HPA axis dysfunction or cortisol problems, meaning you have stress, all right? So HPA axis dysfunction is one of the most prevalent conditions. You're not taught about it again in traditional medicine, sadly. And, stress, it does kill. Okay. So it is a serious threat to our health because it takes decades to occur, but it's happening. And it's definitely happening under the surface. And I know people feel that. It's just that most people don't know what to do about it. All right. So symptoms, gain weight and unable to lose it, especially around that belly. Middle-aged patients, they start complaining about that. Decreased immune system, meaning you're getting flu and other respiratory issues, infections, trouble when under pressure, hard to concentrate, reduced sex drive, lightheaded, can't remember things, lack of energy, and then you crash in the afternoon during Starbucks happy hour, right? You feel better suddenly for a brief period after a meal, and then sometimes you'll crash. Tired at 9 to 10, but if you resist going to bed, and then when you finally do go to bed, you might have racing thoughts. You have coffee or stimulants, cravings for sure, pain with no clear reason. You feel better when there's less stress, like on a vacation, okay? And hard to get up in the morning. You can keep reading all of these. Lethargy, lack of energy, etc. Okay, cortisol is huge. So, causes stress. Number one, all right, we live in a 24/7, 365-day a year world. We're not meant to be running from the bear 365 days, 7 days a week, 24 hours a day, okay? We were literally intended to have these bursts of adrenaline and cortisol from our adrenal glands for fight or flight so that we could protect ourselves and stay alive. And unfortunately, now with phones and computers, and yes, all the things that I do as well, we're under a lot of pressure, constantly moving, issues with kids, marital issues, you name it, right? And so we really were not intended. We also do it by ourselves without a community or a village, which we were not intended to do either. So HPA axis dysfunction or adrenal insufficiency eventually occurs because the body cannot compensate and recover from that amount of stress and adrenaline and cortisol secreted. Okay. So the other thing is that most of us in this country do not eat well, right? Don't eat our fruits and vegetables, don't eat good proteins and fats, don't sleep properly, don't do physical activity, don't do meditation and things that help turn on the parasympathetic nervous system. And so we don't handle stress well, okay? And so it's this constant problem that we are going through due to stress. And remember, stress doesn't just have to be external. If you have a chronic disease, that's a stress also, right? Which you'll see here. So things that also cause stress on your body: chronic fatigue, depression, chronic illness, excessive exercise, yep, toxins, GI issues, sleep deprivation, chronic pain. Nobody has those. That's like med school in a nutshell. Okay, cool. So what happens to the body when cortisol is lowered? You reduce insulin sensitivity, reduce glucose utilization. So basically your blood sugar goes up, all right? Blood sugar goes up, you get fat deposited around the waist, okay? Because whatever glucose you don't burn, whatever insulin can't take care of, if you overconsume sugar, which you do when you're stressed and craving sugar, it literally will increase your blood sugar, but exponentially, because your insulin is not working. Your body's becoming resistant to it, okay? So now you're going to start to store more fat around your midsection. Okay, that's a stress response. Reduced immune response. So patients that have a lot of stress tend to get higher rate of infections and chronic infections like yeast overgrowth, viral infections, mold, etc. Aches and pains, okay, and swelling. A lot of people get swelling that have cortisol issues. You don't need a diuretic, okay? That's not what the issue is. The other thing is that people start to get high blood pressure. It gets to the point when you have cortisol or adrenal fatigue, adrenal failure, and I do have 2 patients that aren't failure anymore, thank goodness, where your blood pressure actually gets really low and you need fluids. That is a sign of adrenal issues, all right? Okay, I could talk about that for, I don't know, days. But the good news is that dysfunction can be reversed with cortisol and stress response. Sometimes 2 years, sometimes 6 months. It really just depends on your lifestyle and how much you're doing to take care of yourself and recover from that stress response. So the 4 pillars of functional medicine truly are the things that help us with the stress response: sleep, nutrition, physical activity, and stress reduction. The other thing that, of course, I have to add at the bottom are reducing chronic infections and disease on your body, because those are stressors on your body, right? So reducing toxins and inflammation, treating GI issues, IBS, microbiome, fix hormones in the endocrine system. Doc, how do I do that? I do testing, okay? We do a pretty extensive consultation. I really determine what I think is going on here based on the history, because the history is the most important thing. And then I figure out what's going on, okay? Other things, nutrition, we'll talk about this later with detox in the liver, but our body is deficient in proper nutrients, okay? It's because our soils turn over 365 days a year. So our root supply does not have the nutrient structure that it needs. And so we are deficient, very deficient in B vitamins, vitamin D, magnesium, okay? So I really do recommend that even if you don't see me, that you at least consider taking vitamin C, B complex, glutathione, multivitamin, CoQ10 or omegas, magnesium, probiotic. Sounds like a lot. I know a lot of we do have a ultra pure pack that has almost all of them in it. Okay. The other thing that helps the adrenal glands are adaptogenic herbs. And we have a lot of them in the office, and I've gone through a lot of different brands and kinds. If you've been with me for 6-7 years, you're probably on your 4th glandular, because they're getting better and better, right? The goal is that you don't need those eventually, but if you're like me and you burn the candle at 5 ends, you need them. All right. What's the most important thing we can do? Always remove the cause. Remove the cause. What's the cause? The stressor. What's the stressor? Family, relationship, financial problems. I know that's easier said than done, but a biggie that I can do in this practice is reduce the illness, stress on your body. also the mental stress. Okay. Helping you sleep also helps do that. Really, really important. Talked about it for a second, is turning on the parasympathetic nervous system. Fight or flight is a sympathetic nervous system, which is cortisol and adrenaline. The parasympathetic nervous system is how you heal. So it's best to practice 10 to 30 minutes a day. You can do yoga. You can do meditation. You can listen to music. You can listen to the Calm app. You can do deep breathing. You can do small rituals throughout the day. Breathing, even for 5 minutes, that is controlled and focused, can change your brain 5 minutes a day for 30 minutes. Okay, that's how much turning on the parasympathetic nervous system, even for a short amount of time every day, affects your brain. MRI imaging of the brain over time shows that even 5 minutes a day of meditation, contemplation, quiet time can really drastically change things and reduce your stress level. So basically what you're trying to do is let something stressful out, let something peaceful in. When you're focusing on the outside world, everything is chaotic. When you're focusing on the inside, the outside intrusive thoughts go away. Another cool thing that we brought in here is Reiki and Reikin, and Reiki is energy healing. And the other thing is Reikin, which is Reiki with IV ketamine. And that's great for depression, anxiety, PTSD, trauma, etc. Two of my favorite things we offer here that nobody else offers that are pretty fascinating. Okay. I've seen it change lives in just the short 6 months that we've brought it on. Good books for things that help with relaxing, meditation, etc. There's also great apps. I mean, when I started, this type of practice 7 years ago, there was the Calm app. I don't know. You could look and there's 2,000 apps at this point, but there's so many good ones. Okay. And they're very inexpensive. So the basics of optimal health and wellness, and these are all the things I look at plus more when I see a patient in front of me and I evaluate them. All right. Nutrition, sleep, stress, physical activity. We talked about that, but also gut health and detox, nutritional vitamin and mineral supplementation, and then bioidentical hormones, the endocrine system, okay, whether that be thyroid or sex hormones, etc. Okay. Detox, cleansing, weight loss. I told you I'm like combining a bunch of stuff. Can you keep talking? Okay. Signs you need help and need a detox or need a liver cleanse, need this medical weight loss, okay, whatever that means when we get to the end for you. Signs that you need help. You're going to see that these things overlap because they do. Everything's connected. Bloated, gassy, constipated. So basically IBS, dull skin, rashes, acne, low energy, poor metabolism, mood issues, body aches, pain, headaches, hormone problems, chemical problems, distended veins under your tongue, elevated liver enzymes. I see that a lot. Okay. That's right now, most of my patients, that is not a traditional medicine problem. That is a detox problem. Okay. Obviously, very elevated liver enzymes due to medications, drugs, alcohol. That's different. That's not typically what I'm seeing in my practice. It was in primary care. Okay, what does the liver do? Everything. Pretty much the adrenal glands and the liver do a lot of things that keep you alive. Okay, regulates fat, cholesterol, cleanses the blood, eliminates waste. Right. This is your powerhouse that gets rid of toxins. Okay. Also controls hormones, cholesterol, metabolism. Super, super important. And our liver is extremely resilient. All of you know exactly what I mean. Not just alcohol and other things, but the amount of toxins and toxic burden that we have now in this country are astronomical. And the fact that our body can keep up with that somewhat is pretty astounding. Okay. I'm surprised that everybody doesn't have elevated liver enzymes at this point with the amount of toxins that we have in our environment, but we don't. And that's because our liver is pretty good. But when these things start to stack and the deck starts to stack, that's when we tend to have problems, which is why a lot of times it's middle age, okay, where we start to see these issues. So meet the toxins. They're everywhere. They're in your water. They're in your toothpaste. They're in your dry cleaning products. They're everywhere. They're in your yard. They're in your neighbor's yard, all right? Sad but true. So on average, women apply 125 chemicals before they even leave the house. Yep, I'm probably part of that too. How do we get rid of toxins? Sweat, urine, bowel or GI, and breath, lungs. Okay, so we're limited in how we can get those things out. How do we get them out? Through sweating. circulation and sweat means move the lymph, right? Lymphatic drainage helps to detox us. That's where we get rid of infections. When you get enlarged lymph nodes in your neck, it's because it's draining the sinus infection that's coming from your ear, nose, and throats. They get swollen. And then what happens is all that lymphatic drainage goes to your liver to be excreted out. All right. So we need to move the lymph. How do we do that? Exercise. Okay. Yep. I'm going to tell you about some cheats later. Sweating and infrared sauna. Okay. That's why we have infrared saunas. But movement and exercise is so important. Anything you can do to get your body to sweat, but it's the movement also that helps lymphatic drainage. Okay. Urination. You need to be drinking a ton of water. I know some of you are like, I don't drink water. That's a problem. You have to drink water. Yes, you can live without drinking water. Of course you can, because you're drinking something else that has water in it, right? But the problem is most people are consuming things that have caffeine in them or alcohol in them. And so every time you consume alcohol or caffeine, you actually need twice the amount of water. You drink a can of soda, you need 2 cans of water. You drink 2 cocktails, you need 4 things of water, okay? So the problem is that we're always behind. And remember, we're made of water, okay? So if kidneys are one of your most important ways for elimination and water is required for that, are you ever going to feel optimal if you don't drink water? No, okay, as I drink it all day. Other things, try not to drink tap water. I know it's hard. We have reverse osmosis at my house. Other problem is that most of the water in this country, if it's not tap water, is bottled in plastic, which is a huge toxin. Even for me, I have I don't know what they're called, the Culligan water things all over one in my office because I drink so much. It is a plastic bottle, okay? I try to do my best. Stainless steel is your friend, so is glass, okay? Water, we talked about it. More energy, healthy skin, weight loss. If you want weight loss, you better be drinking water. If you want to detox, you better be drinking water. If you want your skin to look good, you have to drink water. What's your biggest organ? You've seen me for a long time, you know, I use this, you know, I talk about this all the time. I also do skin for a living, right? In aesthetics. Your skin has to have water to reduce fine lines, wrinkles, dry patches, etc. Okay. These are all the things that water does. Detox water. So I encourage people, if you hate water, add fruit to it. And I mean lemon or orange, but preferably lemon because it's a detoxer. The other thing are herbs, ginger, turmeric, curcumin, cucumber. Okay. Those are great things. A little lemon water every morning is very good for you. Bowel movements. I talk more about poop in my practice than I ever thought I would, but it's super important. Okay. So it is not normal to go to the bathroom and have a bowel movement once a week or twice a week, which I was told in traditional medicine was normal. That's not true. Okay. You've got to be getting your toxins out. Your bowel movements are the #1 way you detox and eliminate toxins. Okay. So my job will always be to help you with constipation and to help you get toxins out. All right. Things that we carry in the office, probiotics, aloe, and magnesium citrate, all completely safe and effective. I do not like over-the-counter things. I do not like Miralax. I do not like any of those things because they have plastic and other toxins in them. Okay, so my preference are natural things that we are lacking in, which are probiotics, aloe, and magnesium. Fiber is great, but if you don't drink more water with fiber, it'll constipate you more. Okay. Breathing, we forget about our lungs. Okay. Exercise, meditation, yoga, breath work, huge way to detox. That's why yoga is so good. I wish I could do yoga. With a lot of my pain, I can't, but yoga is good because it's meditative, it's exercise, you're stretching, you're doing lymph flow, and you're meditating. All right. So it's a good one if you can do it. Lifestyle, avoid chemicals in your home. Okay. Avoid scented body products, always use glass or stainless steel, take your shoes off inside, avoid fragrances, avoid plugins that go into the wall. Everybody wants those in the office. I don't have them. They have petroleum in them. Okay. Not to mention I have chemical sensitivity with Lyme. I know it's fun and boring to be me. But they really make a big difference to get those things out of your hands. They are toxic, right? Everything adds up, unfortunately. So traditional dieting is where we have temporary weight loss, right? And then what happens is we give up, we crash, we burn, we start craving, getting irritable, and then we go back to where we were. And I'm not naive to this side. This happened to me too prior to functional medicine. Nobody believes me, but it's true. Versus cleansing and detoxing, right? Your toxins are stored in your fat. That is where they are stored. So if you don't get rid of the toxins, you don't permanently get rid of fat. You can temporarily get rid of fat, not permanently. Okay. So I love infrared sauna for weight loss because it helps detox you through sweating. Also, infrared sauna penetrates the skin layer, helps go intracellular into the cells, thereby allowing you to detox through bowels and urine. Okay. You need to detox to keep that weight off, right? So toxins, they're everywhere. The problem is now we have over 300 toxins in our bloodstream and in the placenta when we're born. All right. And so, yes, my poor children, I didn't know I had autoimmune and all these weird things when they were born. And yes, they have my weirdness. Okay. They got my microbiome, they got my toxins, they got Lyme, they got all my weird stuff. Okay. So the more you can do to reduce toxins in your life and reduce your toxic burden, the better you will be later in life, because we know that cancer and heart disease and musculoskeletal things and neurodegenerative things like Alzheimer's and dementia are caused by toxins, right? So toxins are stored in fat, more toxins, okay? More toxins, more fat. All right, how do we detox? Phase 1 and phase 2 of liver. I won't bore you to death with that, but yes, things have to go out of your liver into the gallbladder, bile, and stool, or kidneys and urine. Okay. There are fat-soluble toxins and there are water-soluble toxins. I need you to have all of these nutrients down here at the bottom. All your B vitamins, folic acid, glutathione, methionine, cysteine, magnesium, glutathione, taurine, vitamin C, B vitamins, glutamine, folic acid, choline, which is why you're going to see that my turbo shots have that in it. Supplements have that in it. My IVs have that in it. Okay. I am trying to detox you for a multitude of reasons. So phase 1 of detox, you put the garbage on the curb. Okay. Phase 2, the garbage truck comes and picks it up. What would happen if you lived in New York City and phase 1 happened and you put all the garbage on the curb, and phase 2 never happened, the garbage truck never came to pick it up? It would not take long for us to realize there's a problem. Where are the garbage trucks, right? The bad news is that we don't realize that in our own body until it's become so accumulative that we are sitting in my office, right? Or somebody office like me, trying to figure out why we have inflammation and chronic pain and hormone problems and a myriad of other things. It's because these things have been going on for a while. All right. So if we can't detox, it's because we don't have these needed nutrients and these pathways are blocked. Methylation, amino acid pathways, etc. Okay. So things that block those pathways, same. Poor nutrition, insufficient vitamins, minerals, alcohol, prescription medications, tobacco, lack of exercise, etc. So all these things inhibit phase 1 detox. They're additive. Long-term health, right? If you can reduce if you can reduce toxins and speed up detoxification and lymphatic drainage, you reduce toxins, which reduces cancer. Huge. Starting to do a lot more treatment with cancer in this practice. And 3 most common cancers in America actually involve lymphatic system and absolutely involve toxins. Okay, breast, colon, and prostate. Absolutely. Okay. Weight loss. What do we need? Right? Mitochondrial health. Your mitochondria, like we talked about, has to create ATP, which is energy. Okay. You need cellular metabolism. You need, to get rid of toxins. Okay. There's so many things that we need for weight loss to happen. It's not just simply calories in, calories out. Please forget that. That's old. It's still perpetuated as a myth. It is not true. No, you cannot overeat and overconsume. Okay. Obviously, that is true. However, you have to really look at detoxing, eating anti-inflammatory, and really fixing the whole body, which is why in my practice, if you're going to do medical weight loss with us, you have to be a wellness patient, where we've also looked at hormones and thyroid and nutrient levels like vitamin D and B12, because we want you to be successful and we want you to feel better. We don't want you to yo-yo diet where you lose weight for 30 days, 3 months, 4 months, and then everything comes right back. And it will if we don't address all of these things and fix the underlying causes. Okay. So I want you to be losing weight while we're fixing all the causes of that. Okay. Insulin problems, cortisol problems, hormone problems, thyroid problems, toxin problems, GI problems, blah, blah, blah. All right. Strategies to detox. Talk about this every day with every patient. Eat more antioxidants. Eat your fruits and veggies. Okay. B vitamins, water, high protein, good fats, less carbs and sugar. They're toxic, certain levels. Sugar's not good for you, okay? Exercise and move your lymph, increase your glutathione. You can do that with our supplements, orally, intramuscular, which is injection in the arm, or glute, or IV. Limit your stress and have a bowel movement every day. What does a lower carb diet, and I hate the word diet, so I should say lifestyle, but what does that do? It has your body burn fat and protein for fuel. If you eat sugar, your body tries to use that as fuel. It's only good at that for about an hour or two, and then you crash. So now you're hungry again, and you're standing in the pantry, and you're looking in the cupboard, and you're like, why am I standing here? I'm not even hungry. But by God, you're going to eat those M&Ms that you just found, okay? And it is because you're crashing. Your glucose went up, it spiked, insulin followed it, cortisol followed it, thought it was a stress response. Dopamine followed it, and dopamine is not your friend. Dopamine craves everything, okay? And so what happened, 1 to 2 hours, that glucose you ate, insulin secreted by the pancreas came out, try to take that glucose, use it as fuel. You overate sugar, not enough proteins, fats, and fruits and vegetables. So what happens is all your body has to use is that little bit of sugar. That's only fuel for 1 or 2 hours. So 1 or 2 hours later, you crash. Your glucose goes down, insulin goes down, cortisol goes down, dopamine goes down, and now you are standing in the pantry, or you're hangry, or you're irritable, or if Papa John's comes by your house, you'll eat 3 pizzas. Yep, I know, because that's how I used to have these issues too, okay? So you need to keep blood sugar stable and insulin low to prevent, yes, always to prevent diabetes, okay? Absolutely, positively. That's traditional medicine for me, always in the back of my head. But also to help those crashings and cravings and cortisol response, right? You also do not want to have that sugar burden on the liver. And the more sugar you eat, the more you crash and crave, okay? So the goal is, if you're avoiding most sugars, I would say added sugars, I have no problem with fruits, vegetables, and real carbs, all right? The more you eat of those, the more you crave. When you stop eating those things, even after 2 weeks, and you'll see we have a 2-week detox for a reason, even after 2 weeks, that is when your sugar cravings diminish, all right? That is when you start to only eat for hunger or for fuel. It's a beautiful thing. That's when you can really start to tap into that weight loss, okay? And if you're eating properly and detoxing properly, you should be thirsty for water, all right? Okay, eat for color. This speeds up phase 2 of liver detox. There's so many reasons. You guys know I'm a big nerd, so I like to give you the why. If I'm like, eat your fruits and veggies. Well, okay, what does that mean? We all know that, but why? There's so many reasons, but there's phytonutrients, antioxidants in there. They're anti-aging, they're anti-cancer, they're anti-toxin, or anti-weight gain. Okay. When you look down at your plate, it shouldn't be white and brown. It should be colorful. All right. 70 years of soil depletion. We do not have minerals left in our soil. They are gone, sadly. Do you have to take supplements? Likely, yes. It's very, 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 very rare I see a patient that is not requiring vitamin D, B vitamins, mag, fish oil, something, okay? So plants might look the same now, but they don't have the same soil. Look at that soil underneath. There's not enough nutrients anymore. So we're not, even if you ate the same as your ancestors did, same nuts, same berries, the problem is that soil is different. Not to mention, add insult to injury, they're also sprayed with 1 million toxins approved by the EPA. Okay. Go away. 1 sec. Sorry, guys. Okay. This is sad, but true. When did we start to see certain diseases in this country go up? Like asthma, obesity, cancer, heart problems, osteoporosis, is when we started putting pesticides, herbicides, fungicides, glyphosate, which is Roundup, etc., on all of our food. Do toxins matter? I would say so. Okay. You superimpose these graphs for heart disease, cancer, diabetes, obesity, asthma, autoimmune, anything inflammatory, more toxins, more chronic disease. Okay. You're going to see it every time, sadly. So, what inhibits phase 2 detox? Basically, vitamin deficiency. That is why I'm such a huge proponent of nutrients. Get them from your food if you can. Of course, vitamins, turbo shot, things you can do for yourself. Okay. I formulated the turbo shot. I don't know. I was still over across the street. So I don't know, 2017, no, 26. I don't know, 2016, maybe 2015. It doesn't matter. So turbo shot. Choline, methionine, inositol, carnitine, chromium, B vitamins, and B12. All of those things you saw on that graphic about detox phase 1 and detox phase 2 of the liver. You need these amino acids and vitamins in order for your liver to detox. Thereby, what would that mean? That does. It lowers your glucose. It helps your insulin work better. It lowers your cholesterol. It helps you detox better. It helps you lose weight. And it helps increase energy by increasing ATP production. Okay. So if you read just this first one, what you'll see is utilization of fats in the body supports weight loss, prevents deposition of excess fat, removes fat from liver, helps prevent fatigue, helps weight loss, helps slow mitochondrial decay or aging, which is associated with Alzheimer's, lowers your cholesterol, regulates carbohydrate metabolism, blood sugar. I don't know. I can't say more good things about the turbo shot. Do we really need it every week? I use it every week. The majority of my patients get it every week. Even if you got it once a month, it would very much benefit you. Okay. I haven't seen a contraindication to it yet, but discuss it with your medical provider. Okay. Replace carbs with protein and fat. You'll stay more full. All right. You'll stay more full. You'll get more nutrients. You'll stop crashing and craving. You'll teach the cells how to burn fat, the fat that you've stored. Okay. The fat that you stored for the winter that isn't coming. If you eat sugar, that's what your body burns. Right. If you don't eat sugar and you reduce that sugar and you eat more if you eat more protein and fat, your body will learn how to start to use that as fuel. Okay. That's what you want. You do not want your liver to be storing fat and sugar and toxins. You've got to move it out of that phase. Okay. How do you know the change is working? Better cholesterol. So there's more good cholesterol, HDL, less bad cholesterol, LDL. Your glucose level is more around 80 fasting, not 99, not 110, not 140. Your insulin's lower and you have a shift in appetite and cravings. It's a big deal. Have I discussed a single drug yet? No. Nope. Okay. So we have a short plan, the 2-week plan, and this is where a lot of my patients start. Every January I do a detox talk. And of course, today I decided to combine like 4 talks just to bore you. And it's a 14-day kit. It is a kit of Nutritional from Biotics Research. I'm actually branding one for myself right now. But right now, this is the one we have. If we run out, hopefully mine is here in the next couple of weeks. But Biotics Research is a phenomenal company. They have white papers, a lot of medical data, a lot of physicians that work there. And it is 15 days of the Nutritional powder, 15 days of the supplements that help with detox, and the guidebook. Okay. Really, really important that you follow that. So you do that twice a day, and then you get your balanced meal once a day. Okay. So important things to do. Make sure you're getting your steps in. When you're doing a detox, no sugar, little as possible, unless it's fruits and vegetables, right? I'm saying no labeled sugar, no processed foods, no alcohol, Fruits and vegetables. Get used to eating fruits and vegetables. You'll eat them if they're in your fridge and prepared. You won't if they're not. It's just that simple. Drink water a ton. Try to do quiet time, right? Deep breathing. If you're in the car and you do meditation app, great. Get a daily bowel movement. If you're not, magnesium aloe probiotic, okay? Infrared sauna at least once a week. We allow you 3 times a week with the plan. Turbo shot weekly. Try to avoid plastics, fragrances. Take your shoes off. Feel the earth. I know it's weird, but it works. You really need to load the liver with nutrients that it needs to repair and increase elimination, okay? So this is what we include. The price is actually lower. So I really want people to be able to participate in some form of detox plan, whether it's this or the ones that we're getting ready to talk about. Actually, this one's a 15-day detox program, but the new one will be 14. 2 shakes a day, 2 supplement packs a day, the detox guide, meal plan, ideas, and then we also include 3 saunas a week, a weekly check-in with the MA and an in-body body composition scan, and weekly turbo shot. That's all included for $345. Okay. If you want it, just email us and we will get you started on that kit. You do not have to be a wellness patient. You do not have to see a medical provider. You can start with MA if you want, of course, or just email me, Dr. Watkins at anuaesthetics.com. This is one of my favorite start programs because you do not have to have all your labs and be a wellness patient. You can really, really start to change some serious things by doing this. I do this program twice a year. It's very beneficial. Everybody needs to do it with the amount of toxins that we're exposed to, okay? And that we expose ourselves to. Huh. All right. What about the weight loss programs that we have here with injectable medications? That is the first time after 77 slides I have talked about medications, okay? So that is how much I believe in functional medicine and what it can do for you. Okay, HCG, I can get it. It is made by a pharmaceutical company now. The FDA took it off the market for compounding, but I can get it for prescription use for patients. It's still very hard to get. So I always tell patients, if we have it and you're thinking about it, do it. I have some that are available now that I can get. I don't know how long that will last, all right? HCG is a hormone that's naturally secreted by the body, secreted during pregnancy, all right? It helps to maintain the production of things like progesterone and estrogen. It also increases the amount of testosterone you make, which is great because if you're trying to lose weight, you don't want to lose muscle mass. You want to lose fat, but not muscle mass. And HCG really helps you to maintain your muscle mass while losing fat. It allows your body to burn fat for fuel, which is what we've been talking about the last 10 minutes, right? Quit burning sugar for fuel that you're eating. You need to burn the fat that you have stored for the winter. You need to be using that for fuel, okay? And it also helps to increase your metabolism. So I became really fascinated with HCG when I was pregnant with my twins because you didn't have to gain a lot of weight. And that was fascinating to me. I also took care of a lot of Oaxacan women in California when I was doing my family medicine rotation. And they were 4 feet and, weighed 90 pounds and had these great 8 to 10 pound babies that didn't have diabetes, et cetera. And it's because they secreted extra amounts of HCG compared to other women. And so their bodies were able to utilize more stored fat called brown fat. And so they didn't have to gain as much weight. They'd have a baby, 8 to 10 pounds, and then their weight would come right off, right? That's because genetically they secreted more HCG, which is pretty fascinating. So it allows women who are pregnant to have less weight gain or require less weight gain while allowing the baby to grow, okay? Because it allows mom to tap into her own brown fat stores and baby to tap in so that you're losing fat. Okay, so in combination with avoiding fat, sugars, and carbs, you burn a lot of fat, but the most important thing patients really see is a change in their body composition, inches. I always say do your measurements before you start medical weight loss, especially HCG, et cetera. Your body composition will change. Even if you didn't lose 30 pounds, you only lost 15, trust me, you'll be 3 pant sizes smaller. That's a big deal. Okay. So we only use sterile injectable form. I don't use any drops, even when it was hard to get. I don't use drops or troches or anything like that. I want to know exactly what my patients are getting. Okay. So you can expect a 0.5 to 1 pound loss per day. Don't cheat on HCG. It will cheat on you. You get to have a certain diet regimen. I don't like the regimen long-term. It's just for those 30 days while you're on HCG. Okay. We want to see you every week. When you do medical weight loss, we don't require it now, but I recommend it. I like you to come in here and do sauna and get your in-body. If you're not using the sauna, you're not doing yourselves any favors, because that is where your toxins are stored as in your fat. All right. HCG, you definitely have a protocol. It is now a 30-day protocol. So you're on a very low calorie diet. Again, I would never recommend a very low calorie diet without HCG or long-term. You do a loading phase where you take the HCG and you eat a bunch of high calorie foods for 2 days. Then you're on a restricted diet for 30 days with the HCG. Then you stop taking the HCG and just slowly increase foods. I tell you, please don't bring in carbs and sugar. Bring in good carbs. That's totally fine. But please keep them out of your life. You have just detoxed from sugar and you've been through the hardest part. Use that to your advantage, okay? The other thing is HCG for me is a litmus test for inflammation and autoimmune. If you feel better on HCG, you probably have an autoimmune or inflammatory condition, okay? Because you're eating a very limited diet, very low calorie diet. And again, I don't love it, but it does help me figure out where my patients are and if they really need more of a workup. So you get 2 meals a day, protein, veggies, and fruit. That's what you get. So you can't have fat or sugar, because what would your body do? Burn those for fuel. All right. Does it interact with medications? Nope. But a lot of times you can get off some of your medications because you'll have weight reduction. Okay. All right. What do you do after the 14-day detox program or HCG? Well, now I have other options. Okay. That's why I brought in the 90-day programs. Been working really hard on those the last year with peptides, and just brought in a new one called semaglutide. And things that you can do: continue the lifestyle changes, right? Limiting carbs and sugar, making sure that you're doing the walking, self-reflection, increase fruits and veggies, avoiding toxins, detoxing 1 to 2 times a year, having a bowel movement, sweating or infrared sauna or working out, water, nutrients. Those are things you can incorporate into your lifestyle, okay? Those are absolutely things that are in my lifestyle without a shadow of a doubt, okay? Oh, we talked about you. Sorry. That's what happens when you combine a bunch of them. All right. Coming soon from me is going to be a hydrolyzed collagen just a moment. Protein meal replacement, gluten-free, dairy-free, protein powder made of bone broth. I like that because now my patients are starting to get almond sensitivities and pea sensitivities and all these other sensitivities because of the way food is processed. So I love this. It is just collagen protein, 21 grams of protein, no sugar, meal replacement, that I really am excited about because it's also GMO, hormone free, from cows in Sweden. I'm super stoked. Okay. Peptides. What's all the rave about peptides? Why? Well, just like hormones secreted by the brain, okay? And over the age of 30, we peak so early. We starting to lose collagen at 25. We start losing stem cells at 20. Peptides around 30. Okay, growth hormone around 30. So your growth hormone started to decline. And as we approach middle age, it has drastically declined. And obviously all of us in anti-aging medicine are always trying to look for not the fountain of youth, but what is anti-aging? How do we use our brain and our bodies at a higher level longer for vitality? So peptides can help your body because they increase the production of growth hormone. They are not growth hormone. Okay. I don't prescribe growth hormone unless you have a growth hormone issue. And I only have 2 patients with that. That is a problem with the pituitary gland in the brain. Peptides help increase growth hormone production. So we need peptides because they help with growth and muscle, bone density, metabolism, emotions, sexual performance, etc. Okay. It's really one of the easiest and most efficient anti-aging therapies out there, which is why everybody's talking about it. I started doing peptides probably 3 years ago, and there were a lot more available, but the FDA has restricted a lot of that. And so they're more difficult to get. And there's a few of them now. So what does your natural growth hormone do? Decrease inflammation, regulate your red blood cell production, regulate fat cell death or fat loss, right? Increase lean muscle mass, help reduce osteoporosis, reduce autoimmune disease, boost testosterone, which helps libido. You can see it over and over again. So within 3 to 6 months of starting, you'll feel it. Energy, strength, endurance, new muscle cells, breaking down body fat, improving heart function, bone function, sleep, right? It enhances your non-REM slow wave sleep, helps to reduce your liver's uptake of glucose, which is pretty awesome. Not very many things can do that. Also helps with insulin producing pancreatic enzymes, improves skin, hair, sex. Need I say more? Okay. One of the big things I've noticed a lot in my patients is definitely sleep. Okay. It changes improves the immune system and sleep cycle. Therefore, if you're sleeping better and improving your immune system, you're increasing energy, etc. Mitochondrial function. Okay. How do I prescribe it? We look at your medical labs. We look at your IGF-1. It is a blood test that we can do. So if I'm going to do peptides, usually I'm going to make sure I look at your IGF-1, maybe your thyroid, your insulin level, your glucose, etc., because I want to make sure you're being optimized. If you have those underlying conditions and you're just taking peptides, they won't be as effective. Okay. So the MD in me is always going to be the MD in me who wants to do things the right way and not cut corners. So subcutaneous injection, little Botox needle in the belly or a fatty area, usually 5 days a week. There's 2 that are done in the evening that we carry, Cimarelin and CJC ipamorelin. Those are injected in the evening, Monday to Friday. Take 2 days off. AOD is injected in the morning, 7 days a week. Okay. Why? Because we want them to mimic how those peptides are secreted by your brain naturally. All right. So most people see the most benefit when they take it longer, up to 6 to 12 months. I always say take it as long as you can. Right? How much will I need, doc? I don't know. How's the rest of your lifestyle? Are you doing lifestyle changes? What's your biochemistry like? What's your toxin level like, etc. Okay. But we can definitely help with customizing those approaches for you. Oh, semaglutide, my new friend. So semaglutide's been around for a minute. It acts like human glucagon-like peptide 1, GLP-1, and it increases insulin secretion. Remember, insulin. Insulin uses your food as fuel, right? So what it does is it increases your sugar metabolism, burns up sugar faster, gets rid of sugar, okay? So hopefully what this does, right, more insulin production that actually works, it will help get rid of the glucose that's in your system rather than you storing it as fat. Okay, so an injectable version was approved in 2017 for diabetes, but it's gained a lot of popularity recently. You might have heard of it as Ozempic, and that's because it helps with weight loss. So, doctors were prescribing it for diabetes and then patients were losing weight. Yay. It's injected once a week. It is a taper, not tapered down. It's actually a tapered up medication. So when used along with diet and exercise to help blood sugar levels, it also helps the pancreas secrete insulin when blood sugar levels are high, thereby helping energy and weight loss. Okay. Also makes you not as hungry because it slows the movement of food through the stomach, right? So a lot of people it helps with that appetite suppression, which is a very nice thing. The next 2 lines on this, you can see, obviously, people who have blood sugar problems do tend to have issues, diabetes, and then heart disease, stroke, kidney problems, nerve damage, and eye problems. Diabetes is still, the main cause of heart disease. Okay. And if you ask me in functional medicine, sugar is also the cause. Sugar and toxins are the cause of cancer. So making lifestyle changes, very important. It's nice to have adjuvants like meds and supplements and fancy things that I do that can help with that. Okay. We do have a lot of oral options that I've taken all of these very effective vitamins, nutrients, amino acids, etc., and put them into compounded formulas. So now I have my own medical weight loss supplements, and I have 4 of them, and they're extremely effective. Okay. The oral meds, whenever you're doing these things, I always say if you can do 90 days, you absolutely should, and probably need another 90 days, at least of some sort of maintenance. You don't have to do it as strict, right, and do all the things, but I've been on this journey of wellness functional medicine for 7 years, and I know that I still need a lot of the things that we do. That's for sure. Okay. It depends on your toxin level, what your chronic disease is. It just depends on so many things. So month one, I know, is a big month for a lot of people. They really just need energy, right? So they need energy just to have some motivation, to be able to maybe walk around and get around and maybe think about doing some physical activity. I get it. Okay. Month two, body in motion, working out, etc., creating those muscles, right? And then month three, I really want you to start doing muscle strengthening, get those muscles strong and lean, and then really continue to support your energy, reduce fatigue, helping with hunger control. By month three, you are much more on your way to implementing this as a lifestyle change rather than just something short term, which is why I really, really, really focused last year on doing something other than just HCG, formulated some new supplements like I talked about, brought in a couple new shots like the triamino shot and the triimmune shot, and really looked at peptides and semaglutide and other options for medical weight loss because HCG is only so long, okay? And the other thing that I'm really stickler about is looking at the underlying causes of things. So looking at diabetes, insulin, blood sugar, hormones, thyroid, vitamin levels, for all of the reasons I've told you the last hour, okay? Lipotropics. Basically, lipotropics are a turbo shot or triaminos. Remember again, turbos, energy, detox, weight loss. Triamino are a blend of amino acids that support the muscles, and I can't spell, to perform and push the body forward. Another thing, losing weight. I don't want you losing muscle. Okay. Medical weight loss packages. This is what a lot of you have been waiting for. And we have the Detox 2-week program. It's $345. That's the one that includes the 2-week kit plus 3 times a week of infrared sauna, the IM shot weekly, and the in-body composition weekly with an MA check-in. It's a huge, good value. HCG, the cost has gone up because it's gone up for us and it's hard to get. Okay. So HCG does include the same 3 things that I just told you. Now we have 90-day packages with semaglutide or peptides alone. That's $14.75, and it includes all the below. What's my favorite? Of course, 90 days of HCG and semaglutide or peptides. Not 90 days of HCG. The first 30 has HCG. The entire 90 has semaglutide or peptides. All right. So that one also includes the supplements, my formulated aNu MD Turbo Drops, Slim Down Lipoburn Elite, and GC Lipo Lean. Also has a consult either at the beginning or the end with a nurse practitioner or a MA, or both, depends on which one you pick. And this month, you get a free functional nutrition consult. So if you look at the value of what's included below, your sauna value for 3 months, $750, your shots for 3 months, $540, your shots for 3 months, $175 times 5. I don't know. You can read it. Okay. When I got some semaglutide in 2 weeks ago, it was all gone in 1 week. I didn't even have enough for staff members who wanted it. Okay. So I know this is a popular package. It works. I've spent a long time trying to get these medications. And I really feel like there is a lot that these can do for you. Okay. While also doing the rest, right? Lifestyle, detox. Okay. Wellness. For me, wellness truly means mind, body, spirit. Okay. Spiritual, social, emotional, intellectual, environmental, physical, and occupational. So we are all different, and medicine should not be one size fits all. Every single person who sits in this chair right here in front of me has their own story, their life, their work stressors, their life stressors, their genetics, their environmental triggers that they were grown up in, mold, toxins, whatever it may be. We are not the same. There are no 2 individuals who are the same. And I very much treat wellness and patients like that. And if that is something that you would like to be a part of, I'd love to be your physician. And I know the nurse practitioners here would love to take care of you too. It truly is my passion, and I love what I get to do. Okay. So do we accept insurance? No. Insurance does not pay for extended visits and considers a lot of things that we do to be experimental. They work though, and they're all backed by evidence-based medicine. Every single thing I do in this practice is based on evidence-based medicine. There'll be plenty of physicians out there that will tell you that is not true. However, there's nothing I do in medicine that I don't have research and data, very good studies to back it up. Okay, I assure you, I will not give you anything I have not done myself first. How much does it cost for wellness consults? Depends on if you see the nurse practitioner or if you see me. We're a little bit different. I do cost more. And my initial visit does not include labs. Theirs does. So their initial visit includes labs and it's $575 for a 75-minute visit, minus $750 for a 90-minute visit. Then you do labs, and then we do another visit for $750 for 90 minutes. Depends how complex you are and where you want to be on the spectrum. Okay. How do you schedule? You call us, right? 816-359-3310. Shoot us an email, shoot me an email, and we could have you come in and do a consultation with our patient care coordinator to kind of shoot you in the right direction. But if you want to become a wellness patient or do medical weight loss, call us, okay? We can talk to you on the phone. You can talk to our patient care coordinator, or you can just call and book. It's probably the easiest way. If what I've talked about for the last hour is really something you want to be a part of and feel better, becoming a patient is the way to do that. Okay. All right. Where do I begin? If I have no dang idea what to do and I'm not ready to commit to anything right this minute, you can do the detox program. Okay. The 2-week detox program, it's on sale this month. So it's $345, which is a reduced price, plus it's $35 off this month. You can do your turbo shots. You can start to reduce your toxins with infrared sauna, physical activity. And the other thing, which I didn't even get to, because that'll be lecture 2, discussion, topic 2, whatever, will be IVs and ozone and biologics. Okay. How do we take you to the next level if you have pain, chronic fatigue, major toxins, Lyme, mold, etc. That's kind of the super science of what I do. And I didn't want to continue to overwhelm people because it's a lot of information I've already given you. So that'll be in my next talk. Okay. So if you really feel like you're ready for that new beginning, you've been looking for something like, why can't I feel better? I know there's an answer out there. I've got to be able to lose weight. Why do I have this fatigue? Why do I have this weight gain? Why do I have this pain or this GI issue? Whatever it is, we're here to help you. There's really not very many things. I'm trying to think if there's things I don't treat. It's hard for me to find one, okay? I really love finding things and making patients feel their best. We get one chance at this world, and I want us all to be able to do it with vitality. Okay, so everybody always wants to know the promos. It's usually my last screen. What are we doing this month? It is Wellness Month. $50 off new patient wellness package with a nurse practitioner. That package is $575. You get 50 off. That includes all of those labs that I talked about already and your visit with a nurse practitioner. It's a heck of a deal. Okay. If you purchase 5 IVs, you get an IV free. If you purchase 90 days of injections, so you buy 3 rounds of them, you get 30 days free. That's a great deal. I've never done that one before. If you do the new 90-day medical weight loss program, you get the functional nutrition consult for free. If you're a member, you get 10% off. Okay. And that consults with Emily Cox for functional medicine nutrition is phenomenal. I recommend my patients maybe to do that after a month or after 6 weeks when they're in the middle of it and they're like, okay, I've done all these things. I'm kind of struggling. What do I do next? That is a huge value for patients. And I really want to try to have my patients meet with a functional nutritionist more often because we have her. $150 off any IV ozone package. We do a ton of ozone. I wish I had time to explain it more. And then 35 off our medical weight loss detox kit program that includes the sauna and the shots, etc. Okay. The end. And because my Zoom doesn't work properly, I can't see if you're asking me questions. I have no idea. So I was going to do a little Q&A, a little chat session. That's okay. No big deal. I've kept you here long enough. You can email me, Dr. Watkins at aNuaesthetics.com. I will be happy to answer questions or at least point you in the right direction. Okay. I hope you all have a beautiful night full of wellness. Okay, bye.